All right, let's dive right in. Have you ever wondered what really goes on during a speech evaluation? Well, today we're pulling back the curtain. We're going to be working from some material from a university course, SLP 524 Week 7, Diagnostic Report Writing, and a clinical guide called Oral Motor Guidelines and Procedures. We're going to break down how the pros figure out what's going on and maybe even more important, how they get it all down on paper.
We're kicking things off with this quote because, honestly, it's everything. In the medical world, if you don't have a record of it, it might as well have never happened. And that's not just, a suggestion. It is the unbreakable golden rule. Documentation is king.
So here's the game plan. We're going to tackle the two big pieces of any diagnosis. First, there's the hands-on, physical exam, where they're really looking at how your speech muscles are working. And second, the ridiculously important part, the written report. That's where all those observations get turned into solid legal evidence.
And let's be super clear about this right from the start. That report, it is not just some note for your file. It is a legal document. It can be brought into court. The stakes are, well, they're insanely high. And that's exactly why every single word matters so much.
Okay, let's get into the first part, the oral motor exam. Think of this as the physical. It's where the speech-language pathologist, the SLP, gets right up close to see how the actual hardware, your mouth, your jaw, your tongue, is all working together.
And what's kind of wild is how low-tech the toolkit is. I mean, we're not talking about MRIs or anything fancy here. It's gloves, a tongue depressor, a pen light, basic stuff. It just goes to show you, it's not about having the fanciest equipment. It's all about the trained eye of the expert who's using these simple tools.
So how do they measure what they're seeing in a way that's not just a guess? They use this framework called STARS. It's like a 6-point inspection for muscle function. So you've got strength. How much force can you generate? Tone. That's the muscle's tension when it's just resting. Accuracy. How precise are your movements? Then you've got range of motion, speed, and finally, steadiness. Are your movements smooth or are they kind of shaky? This is how they turn what they see into actual, usable data.
So let's make this feel real for a second. Take a look at a simple lip test. The SLP will ask you to pucker up, then give a big smile, then puff your cheeks full of air. And then they'll gently push on your cheeks to see if you can keep that air from escaping. See, they're not just messing around. They're systematically testing your lip strength and something called a labial seal. Simple little actions that tell them a whole lot.
Now, for something that might seem a little weird, you'll get asked to repeat sounds really fast, like pa-pa-pa, then ta-ta-ta, then ka-ka-ka, and finally, you gotta string them all together, pa-ta-ka. This isn't just some silly tongue twister. It's called a Diagnostic kinetic rate test. Yeah, I know, it's a mouthful, but Diagnostic means successive and kinetic means movement. So it's a test of how well you can make rapid successive movements, and it's absolutely crucial for spotting motor speech disorders like apraxia, because it pushes the brain's motor planning to the absolute limit. It shows how well you can coordinate all those complex muscle movements you need just to talk.
Okay, so the physical exam is done. The data's been collected. Now comes the part that honestly really matters, writing it all down. This is where a clinician's skill is put to the ultimate test, turning what they saw into a report that can literally change the course of someone's life.
The first rule, the most important rule of writing these reports, is this. You describe behavior, you do not label a person. So, instead of writing something like, the client was uncooperative, you'd write, the client turned away from the task and did not respond to prompts. It's a small shift in language, but it keeps the report totally objective, grounded in facts you can actually see, not feelings or judgments.
And a huge part of being a pro is knowing your boundaries. An SLP, they're the expert who can diagnose a speech or language disorder, for sure. But they absolutely cannot diagnose something like ADHD or autism. That's just not in their lane, it's outside their scope of practice. And you can never, ever promise a specific result or a cure by a certain date. That's an ethical line you just do not cross. Period.
Okay, now that we've got the big rules down, let's do a little rapid-fire round. The practical do's and don'ts that separate a rookie report from a professional, legally defensible document. First up, precision is everything. You gotta avoid vague words and be brutally specific. So instead of saying the client struggled with some sounds, you write the client substituted the W sound for the L sound in words. See the difference? And use full words, not a bunch of jargony abbreviations. And always stick to what actually happened. No exaggeration, just the facts. Next, your writing has to sound confident. You're the expert, right? You did the tests. So you've got to ditch all that wishy-washy, non-committal stuff like, it appeared that maybe. No, "You write," "testing revealed," or "the client demonstrated." Use the active voice. It's direct, it's strong, and it shows you stand behind what you found. You're not floating a theory here, you're presenting evidence. This right here, this is a masterclass in professional communication. Just look at these examples. Instead of a negative label like lazy, you reframe it into something constructive and professional, can perform better when motivated. Instead of the word failed, you just state the objective fact, did not meet the requirements. This isn't about being politically correct. It's about being accurate, objective, and actually useful. So you've followed all the rules, you've done the exam, you've picked your words with surgical precision. What does the final product even look like? Let's break down the actual structure of the diagnostic report.
So the final report isn't just a big block of text. It's got a very clear flow. You kick things off with background info, just to get the whole picture, then behavioral observations, which you actually saw in the room. Next up, you hit them with the hard numbers, the test results and the oral exam findings, and then you bring it all home with a summary that connects all the dots and, most importantly, gives recommendations for what to do next.
And check this out. This is what that test results section actually looks like. Just look at this for a sec. See how it's not just a list of numbers? It's all laid out in a clean table. For every test, you get the raw score, sure, but the important parts are the standard score and the percentile rank. That's what gives the number context. And right next to it, there's a description, like average or below average, so that anyone at all reading this knows exactly what that data means. It's all about making complex info totally clear. Okay, so we've walked through the physical exam, the nitty-gritty of the writing, the final structure. Let's just take a step back and ask the big question. Why does all this obsessive detail matter so much?
Because when it comes right down to it, it's all about this. An observation is totally useless if it isn't communicated clearly. A test score means nothing if it isn't interpreted the right way and put into context. The whole diagnostic process, everything we've just talked about, it lives or dies based on the quality and the precision of the writing.
So I'll just leave you with this final thought to chew on. We're swimming in data, right? Metrics, analytics, it's everywhere. But when it really comes down to understanding another human being and figuring out a way to help them, is it possible that our most powerful, most critical tool is still just a clear, accurate, well-written sentence? Something to think about.